following program is rated GE. It is suitable for general family viewing.
Welcome to Body Garage, the art of well-being, and thank you for all the supporters that keep watching our show. Today, it's another Thursday, and we invite you to a very, very crucial conversation that we're going to have. I'll be host, Dr. Chepsi, and today we are talking about sexually transmitted infections. And the World Health Organization reports that about 1 million new cases, new infections happen every day all over the world as far as the sexually transmitted infections are concerned. We invite you for this wonderful conversation, and our guest is Dr. Raphael. Karibu sana.
Karibu.
Yeah. Thank you so much, Doc, for setting time to be with us. Yes. Before we go into the conversation of today, if you don't mind, just introduce yourself to our viewers. They would like to know who you are and what you do.
Okay, my name is Raphael Mashimango. I'm a medical officer. I've been working in Shalom since 2017. Yes.
Shalom Hospital.
Yes.
Where we are.
Yeah. Yes.
Yeah. All right. So, Daktari, we are here to talk about sexually transmitted infections. And people will ask, what is this? What are these sexual transmitted infections?
Sexual transmitted infection or sexual transmitted disease are infection transmitted through sex. It can be oral, vaginal, or rectal sex contact, and all of them are sexual transmitted disease or sexual transmitted infection. Yes.
All right. So what will be some of these examples of these sexually transmitted infections?
Basically, I want to divide them into two, the curable and non-curable. Curable are basically bacterial infection or parasite infection. There is chlamydia, there is gonorrhea, there is syphilis, there is candidiasis, and these other, which are not curable, are mostly viral. Virus are HIV, we have hepatitis B, we have human papilloma virus, and we have herpes simplex virus, yes. So if we divide them like that, it will be so easier even to advise on people when they get an infection, which one is curable and which one is not curable, and even the implication of treatment. Yes.
Okay. Now, many times people might confuse the sexually transmitted infections from urine, the ones we call UTI, urinary tract infections.
Okay.
Are they the same or are they different? What is the difference?
The difference is a sexual transmitted disease, you get the infection through sex. Unfortunately or fortunately for a man, it's the same passage or the urethra which we use when you urinate and we use to ejaculate at the same time. But for a female, they have two, let me say, two orifices, the urethra and the vagina. So for a female, it's more of clear, where the symptomatology will come from the vagina, and for a male, it will come from the urethra, and sometimes the diagnosis of urinary tract infection still apply for sexual transmitted disease. But when you are keen enough, you will know where to divide them, especially when you take history and there is history of sexual contact or sexual activity unprotected, you will know this is a sexual transmitted disease or infection. Yes.
Okay. So what I'm getting is that you're saying for men it is a bit hard to differentiate the UTI, the usual UTI and the sexual transmitted?
Yes, but when you go deep in the history.
In the history.
Yes, well, you are taking an history as a medical officer or a clinical officer, you will know this is a sexually transmitted disease. Yes.
But for women, it can be...
For women, it come clearly, whereby the symptomatology, the clinical presentation, it will be more focused on the vagina than on the urethra. But the urethra can, she can complain about maybe urinary dysuria, the pain when urinating, when passing urine, but you have to go deep so that you differentiate the two. Yes.
All right. But can we say also sometimes the UTI, the usual urine infection, can also come after sex?
Yes. Especially when there is no proper hygiene, that can come. But it does not mean it's a sexually transmitted infection. Yes.
You know, many times when maybe you sit in your clinic, have you ever found, especially women who come with pain while urinating, right? And you will do the urine test and they find that she has a UTI. And they ask you, is my partner cheating? Is it?
Yes, that is a common question.
Yeah.
Okay. And the problem is this. Compared to the male anatomy, female is more prone to infection. The urethra is short, compared to a male urethra. And even the proximity, the urethra to the vagina and the anus, yes. So when someone asks you that question, back in their mind, they already said, okay, my partner is cheating on me. And you have to clarify what is STI and what is UTI, okay? And you look for all signs and symptoms of STI. If there is no signs and symptoms of STI, then that is a UTI. And it's always good, just to put things clear, you call both of them, you do a urinalysis for a man, which most of the time come clear or clean, there is no infection. And from there, you can advise the wife and you can even treat the wife so that that misunderstanding in between a male and a female or in the couple be sorted out. Yes.
Great. So at least we are clear on that part. All right. Now that we are talking about the symptoms already, what will be the common symptoms for? I know there are specific sexual transmitted infections, like you mentioned, the gonorrhea. I mean, in Nairobi there was the outbreak of the super gonorrhea.
Yes, that one.
Yeah, and then the syphilis, the chlamydia, and all those things. But they are the umbrella symptoms. What will those be before we mention the specific?
Before we mention the specific, people should know that most of the STI or STD are asymptomatic.
Asymptomatic. Like you will not feel anything.
You will not feel anything. That is the trap. That is one. Two, it starts like a UTI, where someone starts complaining by, when I go to urinate, I feel like itching or pain, or after 2 days, then there is a burning sensation. After that burning sensation, someone maybe may go to the chemistry and they are prescribed some medication. Then it comes to abdominal pain. For a male or a female, when it's a bit advanced, then there is discharge, urethral discharge or vaginal discharges. Okay. So the urethral discharge, it depends on the color. Some may be greenish, brownish, whitish, depend on the germ. And for a male, it's still the same. And from there now, we are able to say, this is now a sexual transmitted infection. So those are the signs and symptoms. Sometimes you may find someone having rashes, sores, like oral thrush, especially for people who are immune compromised. Yes, so those one will have those problems, especially HIV patient or patient on kidney disease. They will have those symptomatology. But normal people, the immunity is okay. Most of them are like simple UTI, especially for men, which can even clear. And for women, especially for women, it's vaginal discharge and low abdominal pains. Yes. And sometimes even vaginal bleeding.
Oh, okay. Yes. Bleeding can happen.
Bleeding can happen, especially from chlamydia. Yes, where they erode the cervix, and it can happen. They can have some bleeding, spotting actually. Yes.
Now let's talk about the specific ones, and let's start with the gonorrhea.
Okay.
The super gonorrhea that was months ago mentioned in Nairobi.
Okay. Let's call it. The super gonorrhea is the normal gonorrhea, which get resistance to the normal antibiotic we give. Okay, so it takes long to heal. Even if you give medication, the person will get symptoms and signs like it's a new infection. And that person is able to infect others even if on treatment. And you remember when you start treating someone, it's 10 to 14 days. But for super gonorrhea, you will have to go up to 21 days. So that is a very big problem. And for gonorrhea, mostly you will find someone complaining of burning sensation.
When they are
peeing or urinating, they have burning sensation, urethral discharge. And for female, it's still the same, but for female, you find they have too much discharges. And sometimes they are, not good to say, but sometimes they are false smelling. Yes. And for chlamydia, also painful urination, but they have pain during sex. Okay. And that one, it's characteristic. So you may have a partner, she tells you clearly, when I have sex, it's painful. So you have to put a question, why? And do the examination, a proper examination. You find the vagina is inflamed and the cervix is inflamed. So from there, you can proceed with a lab test and others just for diagnosis and treatment. Yes.
Right. Now, let's talk about this that you mentioned about incurable. Maybe we can talk briefly, just HIV, but because that is a discussion on its own. But more about this, the herpes. Yeah.
Those one, normally it's through contact. Okay. There is this, it's not a new practice, but you know, now we have homosexual, and if it's a man to man, they use the anus. Okay. It's an anal sex. And the rate of infection, it's very high. Okay. And most of them, they don't even know until they start developing those signs. The what, someone may have vaginal what. It's not like
those growths.
The growth. It's not like everyone with vaginal what or, yeah, let me say that, other anal intercourse. No. Yeah. But for men, you have to check on the history very well, because anal intercourse, at 70 to 80%, someone will get the HPV. And why did I say they are not curable? Because the treatment, you know, virus, we don't have treatment, and there is some, not treatment, but there is, we manage the symptoms, and we boost the immunity, and so that the body can fight itself, the disease. But there is no way someone can be cured 100% like these other diseases, like bacteria and parasite. Yes.
So what will be the greatest challenge with these non-curable sexually transmitted infections?
The greatest challenges, one is that they can't cure, that is one. Two, you may find someone getting the disease and they delay consultation. That is a very big challenge. And the third one is that it's one person to another and people don't basically consult on time. So that is the greatest challenge we are having with this disease.
Like from the infection to the time the person is seeking treatment, it's
yes,
long time.
There is a very long time. You know why? Let me say, I have a growth on my penis. Who will I go to show my penis? It's totally difficult for someone. And until it becomes worse, then the person comes to see the doctor. And at that particular moment, maybe it's too late for the doctor to act.
All right, thank you. We are going to take a break and we are back. We are going to learn who is at risk of getting the sexually transmitted infections. So stay tuned.
Na safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.
Nikuwe na Nisani kama 10 na pia nikuwe menua minibus. Minibus niko niwa.
Kushinda unaangalia simu ya mzee. Soma Biblia ama ingia kwa washroom ujisugue. Mpaka nimetoa hii.
I don't know whether any of my children would want to get into the political field. Sijajua bado.
Kila Alhamisi saa 1:30 kuendelea.
Join us on a journey through the concrete jungles and rising skylines, where every beam, every nail tells a story of progress and vision.
In every aspect of life, you know, you have to look at several dynamics.
From groundbreaking
Nowadays with the tech, you can check on different websites or you check online and you can see some inspiration. So at least that one would be a direction already. I'll know like what kind of style you're going for.
to finishing touches.
Welcome back. You are watching Body Garage, the Art of Wellbeing, and we are talking about sexually transmitted infections. And in the part 1, we finished by discussing about the symptoms that you will see in sexually transmitted infections. We mentioned about pain while passing urine and discharge and so on and so forth. Yeah. So our discussion now will be about who is at risk of sexually transmitted infections.
Okay, who is at risk? Women are at risk than men. And why? Because when you are having an unprotected intercourse sex, a male who is infected will actually ejaculate into the vagina. And the time, the contact in between the semen and the vagina will be more longer than for a man a contact to the disease. So that already put a female into a risk compared to a man. Yes, the second one are adolescent and young adult. Why adolescent and young adult? Those are people who want to explore more. Yes. So you may find they have, let me not say they have the knowledge, they have the information, but they don't want to apply the information. I think at school they have that course where They teach them how to protect yourself. But you may find someone
Like the sexual education.
the sexual educations,
Yeah.
but you may find someone, instead of applying, that person decide not to apply and apply only the family planning. And this is common, especially for women. They feel like when you have a family planning, it's enough. There is no other disease, or the only disease you may have, it's only HIV. These others, you don't have. And the sad part is maybe ignorance, maybe trust, whereby someone may say, I've been living with this man for a couple of days, or even a whole year, or even 6 months, and haven't seen him having any issue or presenting any complaint relating to STD or STI. So this man is just okay. And the man actually is sick. And you know this world, no one will come and tell you I'm an HIV positive, I have chlamydia, or I have syphilis or gonorrhea. No. And before even we start, you see, and there is these young people, they go and having only one condom. When they have finished the first shot, they don't have another one, but they want to continue. That is a reality. They want to continue.
Yeah.
So what do? The second shot, they go. And they don't even ask without any protection. So it's kind of serious, and they are sexually active. I think it was last year, around 200 new cases of HIV were diagnosed on a weekly basis. In between 17 and 21 years. You see, it's a very big concern. Why? They are sexual active, but they don't want to apply the information they are getting given. Okay? So those ones are at risk.
So most of the time, the main thing that bracket is concerned is about preventing pregnancy.
Preventing pregnancy only.
Okay.
You know, having a child, it's a burden. But if you are using already FP, family planning, that one you already saw. And this one, you forget about it.
Forget about HIV.
You forget about HIV, syphilis, gonorrhea, HPV. You can go. Because for you have sorted this part of family planning. Okay? So there is this other sex workers. For them, that is their work. And these people should be well educated on these diseases and how to protect themselves, because that is their work. And you may find someone who comes, I know myself, I have gonorrhea, but when I come, I ask you, how much will you ask if I want it without protection? Then you tell me, okay, 5K. I may be willing to give you 5K, but I know I'm giving you a disease. I'm transmitting a disease. So you get? So they should be well educated and to be more strict about themselves and what they are doing in terms of their own protections.
So when we say they should be educated, because this is work, what should they do? No, should they have testing kits with them always?
Okay, it should be regular. You know, here's the problem. When people look at them, we feel like, hey, these people are not pure. So they feel like, not them, but this other part feel like we should reject them. But the part who's rejecting them, at night they go to meet them. This is true.
I mean, that's usually what happens.
So we should organize more sessions, okay? Actually educate them how even to get tested, when they feel bad, when to consult, how many days to get treated in the hospital, do you need an hospitalization or not? Those are important information they should.
That is for the person, the sex worker, right?
Yes.
What will they do about their clients? Should they have testing kits by their apartment?
You know, yes, the problem.
So when you come for service, I test you first.
No, who's going to accept that? No one is going to accept that.
Yeah.
But the problem is this: there is so many ways to protect themselves, and the easiest and the cheapest is to use condom. Okay? If you come and I tell you, mister, we are not having this without condom, whether you like it or not, it's condom.
Yeah. Yeah.
But if someone comes and tell you, I need to do it or I want to do it without protection, you should ask yourself a question. Okay? Because
You should question the intention.
yes, what is the intention between, let me call it bribe? Why? Because everyone is concerned about the disease. But if someone comes and don't care about the disease, it means that person has the disease. So they should be informed. If not having a kit to test the client, they should be having a kit to test themselves. Yes, so that they know how to protect other people.
So it's about protecting themselves, but also
Yes, and
protecting
protecting the client.
their clients.
Yes.
All right. That makes sense.
And
Okay.
there is immunosuppressed patient.
Yeah. You know, the immunosuppressed is a big term for people to understand. What does that mean?
Oh, it means someone, okay, all of us have an immunity in our body which help us to fight the disease at a certain level, if it can. It can. But if your immunity is suppressed below the required, and if I say below the required, it's about CD4 count and CD8 most of the time. So if it's below 500 now, so you are kind of immunosuppressed, and most of people are HIV positive,
So
maybe
there's
with kidney diseases,
Okay.
and bone diseases, cancer. They are immunosuppressed. Okay.
Like those underlying illnesses, conditions
Yes.
will put their immunity a bit lower than
A
a
bit lower
person
than
without
a normal person.
without those illnesses.
Yes.
Okay.
And now, if you expose that person to the disease, okay, and let me say the disease take an advantage of that suppression of the immunity, and they can develop the disease actually faster than other people. That's why I say the majority is asymptomatic, because the immune system is still fighting,
It's still fighting, yeah,
for the person. But for this other one, the immunity is already low. So for them, let me say it's 90 to 99%, they will develop that disease, the symptoms. Okay. So for those one, they should also get a proper education on the STI and how to protect themselves, so that they don't get the disease. So it's very important for them.
Okay.
Yes.
That's good. What about the same sex?
The same sex. Okay. Here's the problem. The same sex we are having, okay, right now, you know, in Africa, that one used to be in Africa. But with mondialization and other things, right now we are, let me say, sliding to the West culture. One is, for a man and a man, it's anal intercourse. Female and a female, it's a mouth and a vagina, or a mouth intercourse. So what is happening for those people, they are exposed the same way as this other one. But I remember I had a professor who was saying, if you find someone with an herpes at the mouth, don't even ask. That one went somewhere and do it.
But that will be an assumption.
Don't even ask.
That will be an assumption.
Yes, I know, but it means that person actually exposed, okay, himself or herself to the diseases, and the transmission is still the same. And people thought, and since me I'm doing with the mouth, maybe I may not be infected, you will get an infection.
So we should not assume that because you are just having oral sex, anal sex, that you are free from sexual infections.
In fact, the rate of infection for those people is higher than this other one.
The rate of infection for anal sex, oral sex,
especially for anal sex,
is higher than the usual.
The usual.
Okay.
The transmission is higher than the usual.
Is there a reason behind that?
Okay. One is you don't find HPV mostly in the vagina, but in the rectum. Okay. So if you do a rectal sex, it's like now you are going to the area where they are and you are having sex. So you may get it easily than someone who's getting a normal vaginal intercourse. Mm-hmm. Okay? Mm-hmm. Okay. If someone is already infected, okay, and the mouth is not infected, you go the proximity in between the vagina and the rectum. You go and do whatever they do. You get the proximity and the rate of infection. So getting an infection from the mouth or through the mouth, sorry, it's also so easy for them.
All right. Okay, we will continue this conversation after the break, so stay tuned as we continue to learn about sexually transmitted infections.
Na safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.
Nikuwe na nisani kama 10 na pia nikuwe menua minibus. Minibus nikoniwa.
Kushinda unaangalia simu ya mzee, soma Biblia ama ingia kwa washroom ujisugue mpaka nimetoa hivi.
I don't know whether any of my children would want to get into the political field. Sijajua bado.
Kila Alhamisi saa 1:30 kuendelea.
Join us on a journey through the concrete jungles and rising skylines, where every beam, every nail tells a story of progress and vision.
In every aspect of life, you have to look at several dynamics.
From groundbreaking,
Nowadays with the tech, you can check on different websites or you check online and you can see some inspiration. So at least that one would be a direction already. I'll know like what kind of style you're going for.
to finishing touches, witness the dedication of the hard-working teams who bring these ambitious dreams to reality. The Realtor, Tuesdays at 6:30 p.m.
Kushinda unaangalia simu ya mzee, soma Biblia ama ingia kwa washroom ujisugue mpaka nimetoa hivi.
I don't know whether any of my children would want to get into the political field. Sijajua bado.
Kila Alhamisi saa 1:30 kuendelea.
Join us on a journey through the concrete jungles and rising skylines, where every beam, every nail tells a story of progress and vision.
In every aspect of life, you have to look at several dynamics.
From groundbreaking
Nowadays with the tech, you can check on different websites or you check online and you can see some inspiration. So at least that one would be a direction already. I'll know like what kind of style you're going for.
to finishing touches, witness the dedication of the hard-working teams who bring these ambitious dreams to reality. The Realtor, Tuesdays at 6:30 p.m.
Why is it important? What is the problem with that?
Okay. We should know that about 1 million people are getting infected on a daily basis.
That's true. In Kenya only or all over the world? Okay.
You know, when you say in Kenya, so people will start looking around, even this one is infected. No. So 1 million. And that is WHO. They do so many researches. But now you see, it's quite a big number of people getting infected, and yet people are informed about the disease. Okay? 2, it is about the burden. When you want to treat someone, from the consultation, the lab test, and the treatment, which can take 10 to 14 days, the costs.
So you get the cost.
The costs.
Treatment also.
Yes. And third, it is about complications.
So before we go to the complications, let's look at the cost. And I think cost, we usually look at not just in money, but
Not
also
just
the time
in
you
money.
spend
Time
on-
to spend.
in the hospital.
Yes.
The time you spend maybe segregating yourself because of the symptoms. On average, how long does it take to treat the common STIs?
Okay. The
Leave out the HIV part,
Okay, not leave out the HIV, leave out the virus one.
the viral one.
Yes. So, a minimum of length, it should be 10 days.
10 days.
Yes, for uncomplicated disease. The minimum is 10 and the maximum is 14,
Sometimes longer.
sometimes longer. For a complicated one, like the supergonorrhea one, you go up to 21. You see, so it takes your time. You are mentally disturbed about the disease, and sometimes you don't even know if you are going to cure 100% or there may be some complications. If you look at the all costs in terms of time, in terms of mental issues, in terms of time you will be spending in the hospital, it's very costly to have the disease than to protect yourself. Yes.
So we should invest in self-protection because that is less.
Prevention is the best, actually. Prevention is the best, it's cheaper, and it does not affect. Unless there is, there is people, if you say use a condom, and that person will say, it does not have the same taste. So it affects the taste. But actually, it's so cheaper.
We will talk about prevention later. But let's look at the other cost. Maybe we can say, because many times when you receive your patients at the clinic, you realize that when they have symptoms, they are questioning about the partner as well.
Yeah,
maybe we can look at that also as a concern to have.
It is a very big concern, actually. Yeah. It is a very big concern. The concern is, one is accusing another one, and they have to go through counseling. Let me give you a scenario. This disease, whenever there is an infection, and most of the time it's a wife which come to a consultation, the first one, most of the time. So she's in the consultation room, we have diagnosed this is let's say maybe a gonorrhea. Then she asked, daktari, mimi nimetoa wapi? Na mimi sijawahi cheat. So in your mind, you say, this other one I've cheated. Will you tell the wife, your husband? That one you don't. That is one. Two, you may say, okay, we will treat you, but she's still insisting. Please call my husband. Okay, the husband comes. You test and you find out even the husband is infected. When you ask the husband, then he tells you, daktari, unajua nilijisaidia mahali, sasa unajua ni kwa bahati mbaya nimepata hii kitu. Will you tell the wife your husband has cheated? That is another problem. Yeah. And will you even send those two people to the counseling session? Yes, you'll have to send them so that there is no stigmatization. But will you tell the wife, actually it's your husband who has cheated? So you'll have to look away, playing safe in between those two so that at least, wife, if they start talking, so everything is about the infection you have brought in the house. Whenever, even if you cough, you have an infection. Don't even cough in the house. So it is a very big problem, actually, even in the relationship, okay? So when you receive a couple having the disease, it's quite challenging, but we normally send them to a counseling session. And sometimes we even follow up, okay? And we educate, actually, so that before we release them, each of them can talk about the STI or STD to their best knowledge. And this time around, no one will go and make a mistake.
Yeah, sure. Now, the cost of HIV infections, we know that's a long term, and it's a heavy one, literally, actually. Not just to the individual, to the family, but as well to the health systems. Yeah.
Where the person works, you see. Yeah. Suppose, let me say, you are a businessman, and you get the disease. For you, it's only when you go out, look for bread, it's when you eat, and you have a family. You are admitted for 5 days. You see the costs, the repercussion into your family now, you see. So if you look at every angle, the protection and the prevention is better than.
It's very important.
Yes.
Yeah, sure. Now let's talk about the complication as part of why is it important to look at these sexually transmitted infections.
Okay. For me, sometimes back I was saying, if you want to teach someone about the disease, start with the complications.
The problems.
The problems. Where is the problems? Because if you start by what is it? It is an infection transmitted through one to another person through sex. Then someone is relaxing. Is this even a problem? It is not even a problem. But when you start with the complication, you tell someone, if you have an HPV, or if you have a gonorrhea or syphilis, infertility can come. Then that person asks himself. So it can be that bad. Yes. Yeah, it's true, actually. So infertility is one of the big concerns, and even cancer. Why infertility? If you take like chlamydia, okay? They destroy almost the vaginal tract, the female tract. They erode the cervix, whereby someone can be having miscarriage, okay? Repetitive miscarriage. And if it's not treated, or treated late and cured, and the cervix still having problem, that person can have miscarriage 3, 4 times, 5 times. And mentally, the person is affected. For a man, the disease travel. It goes to the testes and destroy the testes.
The testes is where things are being manufactured.
Things happen there. The production is there. Yeah. Now there is no more production. And, okay, suppose you are not married. You get the disease. You got the disease. And now you are married. You want to have a child. Things are bad. Destroyed already by the disease because you didn't want to consult on time. You got some medications somewhere there for 2-3 days because you felt well, you have stopped the medication and the complication is already there. You are not able to produce normal sperm or spermatozoid. And now you are married and you are unable to get a child. You know, yes, this is Africa. Everyone look at the female, your wife. No, why is she not getting pregnant? And the problem is there is, he knows the past, where is the problem? So infertility is a big concern for a male and a female. 2, it cancer. HPV, rectal cancer. It's very serious. People don't know about it, and people have had someone telling me, do you know the rectal intercourse is it's sweet than the vaginal one? Then I look at that person. I was like, okay, it also have a high risk of rectal cancer than the vaginal one. So people should know that. You may get a rectal cancer by getting a rectal intercourse, especially from someone who's already infected. Then there is this PID, pelvic inflammatory disease, whereby you have pain, it's a chronic pain, you go, they treat you, but it does not go away. And let me say the last one, it's stillbirth, pregnancy. You have the disease. Complication is in pregnancy. You have the disease and your baby has been kicking all the time. And one day you go to the consultation, they tell you the baby is no more there.
So the baby can die.
Can
the
die.
baby can be born with
There are some diseases, problems, malformations, and others. Okay. Sometimes there can even transmission, mother to the child when the baby is being delivered.
Because of time, let's talk briefly about the treatment. We've mentioned part.
Okay, the treatment, the part of the treatment, we have said this other one, the virus one, we don't cure. This bacterial gonorrhea, syphilis, and chlamydia, at least there is treatment. We use antibiotics most of the time. And if someone follow the treatment for 10 to 14 days, actually they do it. Yes.
But they'll have to be tested.
To be tested.
Yeah. To identify the specific.
Testing prior the treatment and after the treatment to make sure this person is no more infected. Yes.
All right, thank you. Your parting shots as we close the discussion for today.
For me, I will say this. We should be more aggressive on educating people on how to prevent the disease, then how to cure the disease. Because you may not know if this time around you have gotten a supergonorrhea, which is difficult to cure because of antibiotic resistance and other things. So that is the most important. Otherwise, for me to say thank you for you guys to come and for the time we have shared together this topic, and hope we'll come again another day so that we share another topic.
And if you are within this area of Kitengela, you can visit Shalom Hospital.
They can visit Shalom Hospital, and we are open 24 hours, 24/7, let me say 24/7, because there is a clinical and a medical officer on duty, not on call, so they can still come. We'll attend to them and give advice accordingly.
Okay.
Thank you.
Thank you so much. As you've heard that as far as the sexual transmitted infections are concerned, there's a lot to talk about when it comes to the burden, but the emphasis is work on prevention. Prevention is better than running around after the infection has happened, but if it has happened already, you can still find help at different hospitals. My name is Dr. Chepsi. I've been your host for today. This has been Body Garage. We will see you next Thursday.
Na safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.
Nikuwe na nisani kama 10 na pia nikuwe menua minibus. Minibus nikoniwa